There's your head on the table. Yeah. Okay, for flexion, you'll first tuck that chin. Okay. Okay. Now just flex your neck. Now, there you go. That's it. That's it. Okay. Tuck that chin. Come up. Okay. Make sure you tuck that chin so you throw out those AL flexors. Okay.
Extend, sort of a leg extension.
Yeah.
So
Extension, flop over. Okay. Let's slide forward with that hip and get a little bit more flexion. Okay. Okay. Come on, back up. Okay. Now turn on one side. We'll do lateral flexion and rotation. Okay, flex that and grab the edge of the table there. Okay. I want to make sure everything is in line this way. You got that lower knee flexed. And grabbing the hand here to try to help keep the body, keep that frontal plane of the body perpendicular to the table. Okay, so for lateral flexion, remember that the muscles that you want, the lateral flexors that you want to work need to be on top. Okay. Now you can go like this, or you can position like this. It's easier to see that the movement stays in the frontal plane if you're doing like this. And then bring that ear to your shoulder. There you go. Okay. Now look down toward the floor, and we're going to do rotation to the right. Okay. Hand position. Imagine that this is a rectangle, just like this here. And so you want this heel to be on the lower left corner as you're viewing it here on this side, and then the right heel hand like this. Okay, he's a little bit, okay. So I'm going to try to keep the neck and the spine aligned. He was into a little bit of lateral flexion. Okay, now look up toward the ceiling. Okay. So that's rotation. And then of course you can flop them over to do the other sides. Okay, what else do you want to see?
we have lateral flexion of spine.
Lateral flexion of the spine. A couple of ways you can do that. You can stay on your side is one way. This is kind of a tough way to do it, but it is against gravity. Get the frontal plane perpendicular to the table, everything aligned like this. Now raise that left shoulder off the table, and I'm going to try to just make sure everything stays in the frontal plane. I think an easier way to do it would be in the gravity neutralized position, so give them back. And so if we're going to do, say, lateral flexion to the left, I'm going to position it all the way to the right. And if the friction of the table is enough resistance, then you just have them laterally flex all the way to the left. Okay. Now, if you find like their hips are kind of sliding around, then what you can do, you can anchor that over the ASIS on both sides. Now I'll go. And that'll keep that lower body still. Okay. You could also, if you need a little bit more resistance than the friction of the table can provide, you can just add some resistance here. As you add that manual resistance in this position, there's an increased likelihood that the hips are going to start sliding. So it's going to be kind of hard to be up here to anchor, to provide resistance and to anchor down here. So you may want to just put a strap over the ASIS and keep it down to the table. Okay, what else can I show you?
Sorry.
One more.
I was just going.
Okay, yeah.
So abduction of the glenohumeral joint.
Okay, several ways you can do that. You can put them in a standing or a sitting position. You can do abduction bilaterally by resisting proximal to the lateral epicondyle on each side, and the movement's going to come up here. You don't need to go any higher than parallel to the floor, because after that it's basically just upward rotation of the scapula. So resist like this. And you could do one side at a time. If you do that, then you've got a hand where you can anchor here and try to limit the scapular movement to get more movement in the glenohumeral joint. Okay. And then now you add a little bit of stretch again. Okay. You can do it in the gravity neutralized position. You take it in the supine position here. And again, if depending on if the person's real weak, just have them use the friction of the table. Okay. Okay. All right. And then I'll move them back down. If they can't overcome gravity in the upright position, but they need more resistance than they get with just the friction of the table, then you can just add some resistance like this.
Adduction is.
Adduction
Right.
in the grab, it's kind of like just basically the opposite of abduction. They can use the resistance of the table. Or if you need a little bit more, you can come resist on proximal to the elbow, just superior to the medial epicondyles. Okay. And then you can stand up and we'll do it in the upright position. You can just go like this. There you go.
Flexion.
Flexion, okay.
It's hyperextended.
Okay, you want to start in the hyperextended position. Now there are two things, something else to consider when you do glenohumeral flexion is the position of the elbow. What are you trying to emphasize? If you're trying to emphasize, if the reason you're doing this is to work the anterior deltoid, then you want to throw out the biceps brachii, so you're going to flex the elbow, resist proximal to the elbow. Now, if you're doing glenohumeral flexion for the purpose of, say, a supplementary or a secondary prescription to strengthen the biceps brachii, then you're going to allow the elbow to be straight. Okay. And that brings in the biceps brachii just a little bit more. But in either case, you're going to start in a slightly hyperextended position to get the whichever muscle you're focusing on a little bit longer.
Internal rotation.
Internal rotation. Okay. Internal rotation. You do it in the prone position, and you want to make sure that the humerus is perpendicular to the spine. Here. And you're going to put a pad underneath the humerus. Internal rotation, you need to start the joint in the externally rotated position before beginning the movement. So, and how you position yourself is kind of up to you. Several options. One option is to resist like this. Okay. He has a slight tendency to want to adduct the glenohumeral joint, so I'm probably going to put my fingers around here to keep him from coming down this way. And then add a little stretch at the end. And now another way you can resist, which may be a little bit easier to provide the resistance, is to come over here on this side and line up your forearm with directly against the way he's moving, okay? And that's a little stretch.
That's internal rotation?
That's internal rotation.
Okay.
And again, you have to start in the externally rotated position, okay? And then, Ms., we'll do external rotation while we're here. Again, you can put your body perpendicular to the humerus and resist like this. Or you can come over here and resist like this. Stretch it. The closer you can get on this anchor hand, the closer you can get your one finger up toward the deltoid, then you can palpate the anterior or posterior deltoid while they're doing the rotation to let you know that it's still okay to add a little bit of stretching in.
And horizontal AD and AB abduction.
Okay, supine or horizontal adduction. Start here. Okay. I'm going to resist proximal to the elbow. Okay. And I'm going to stretch it across. Let's do another rep. Okay. Now flop over. We'll let the arms hang down. Horizontal abduction. I'm going to start them a little bit crossed. That puts them in the horizontally adducted position. Resist proximal to the elbow. Okay. It is possible to do one side at a time.
Would that just be?
If you want to do one side at a time, come over here. Hang down. You can do one side at a time, just like this. I'm not sure why I can't give you a specific instance where you would want to do one side at a time, but that's how, likewise with horizontal abduction, you could do one side at a time. But I think most of the time you're probably going to be doing bilateral exercise.
Did we do extension, hyperextension?
Extension, okay, extension, hyperextension. Couple of ways you can do that. You could do this. You could go here, okay, and then push back. Now, to get a better terminal position where gravity has more of effect, okay, lean forward, okay. Now come back. Okay. Now you can also do it prone. Just let that arm dangle off the side and way over to the head. There you go. Like this. This is probably my favorite position, but it's not the only one. Remember when you're doing hyperextension, extension/hyperextension, that elbow position is going to make a difference depending on what muscle you're focusing on. If you're focusing on the posterior deltoid, then you want that elbow extended to throw out the middle head of the triceps. If you're doing hyperextension, doing a humeral joint to get some work on the middle head of the triceps, then you want to flex that elbow while you extend and hyperextend.
And all the wrist movements.
Okay, wrist movements. Let's put you in a chair. I'll just sit right here. Okay. We'll start with extension, hyperextension. Now, because some of the extensors originate off the lateral epicondyle, you're going to need to, you can think about elbow position depending on which wrist extensors you're working on. The wrist extensors that come off the lateral epicondyle are going to also assist in performing elbow extension. So if you want to throw out the muscles that cross the elbow, then you're going to want to have the elbow straight, like this. If you want to target the extensors that cross the elbow, then you're going to have the elbow flexed. So I'll just show it to you in the flexed position. Okay. Now, finger position. have some wrist extensors that just cross the wrist. You have some wrist extensors that go all the way down in the fingers. Okay. If you want to throw out the muscles that go all the way into the fingers, thereby isolating the muscles that don't go into the fingers, that just cross the wrist, then you want to do this movement with the fingers extended. So I'm going to resist proximal to the MCP joints. And you can resist this way, or if you feel like you get enough resistance with the thumb. Okay. Now, if you want to focus on strengthening the wrist extensors that go all the way down into the fingers, then you're going to leave the fingers flexed. And again, if you want to resist this way, and then use your thumb to stretch out, that's fine too. Okay. Wrist flexion. Okay. Some of the wrist flexors originate off the medial epicondyle. If you want to throw those out, then you're going to have the elbow flexed. Okay. If you want to isolate those and get those involved, then you're going to have the elbow extended. And I think it's easier, rather than have him slouch down on the side, if you want the elbow extended, get him over here and just reach across the table. I'll demonstrate with the elbow flex, so he can just go ahead and sit up. Okay. So here we're throwing out, in this position, we'd be throwing out, the elbow flexors the wrist flexors that cross the elbow, and emphasizing those that originate distal to the elbow. Okay. Okay, finger position is important too. If you want to focus or isolate the muscles that go all the way out into the fingers, like your flexor digitorum superficialis and your flexor digitorum profundus, then you're going to have the wrist flexion done with straight fingers. If you're going to throw out the muscles that go into the fingers, so you can focus on the muscles that just cross the wrist, then you're going to let the fingers be flexed. And again, whether you resist like this or like this, no big deal. And again, you don't have to sit on the table. If you want to come down here, that's fine. Feel better coming over here because you can resist better with this hand. That's fine too. Okay, now we need to do ulnar deviation and radial deviation. So come over here, we're going to shake hands. Okay, so radius here, ulnar here. So ulnar deviation, you're going to shake hands and start in the ulnarly deviated position. Stretch the hand. Okay, now for ulnar deviation, it's just the opposite movement. Start up here and bring it down. Okay.
Fingers. We'll do that.
Yeah, fingers, yeah. Okay. You can get pretty anal about these exercises. Okay, you've got some extensors that cross the MCP joint, some that go all the way out. And it just, depending on which ones you're going to work. If you want to maximally work the muscles that go all the way out, you want to do extension here, here, and here. So MCP extension, line up the MCP joints on the edge of the table, anchor here, resist proximal to the PIP. Now, as you get to the PIP joints, it's getting harder to align these joints on the edge of the table. But it's barely doable. Now, there's no way you can get these DIP joints. So, if you have a need to prescribe extension for the PIP joints, you're probably just going to have to do each one individually. Okay. Just work your way down the fingers. Same way with flexion. You can resist here and do the MCP joint. You can go here and do the DIP, and then here you're just gonna have to do just in each individual finger. I would say most folks, when they're actually prescribing, they're probably going to be satisfied with just doing all at the same time. Again, you're probably not going to have but maybe 15 minutes with each patient before another patient comes in. So, but I think it's important to know that as you exercise each of the joints and the fingers, you're varying the ability, the extent to which you exercise different muscles. Because if you do the wrist flexion and MCP flexion, DIP flexion, and PIP flexion, you're getting a very good workout on the flexor digitorum profundus. You can omit the DIP flexion and just still be getting a good work on the flexor digitorum sublimis, because the sublimis doesn't go all the way out to the distal phalanx. Okay, what else?
Supination and pronation of the elbow.
Okay. Supination and pronation of the radioulnar joint. Get that elbow in tight, elbow at 90 degrees, palm down, puts it in the pronated position. If they turn palm up, then they're supinated. Okay? Keep that wrist straight. If you see them flexing the wrist, you're probably putting in too much resistance. Okay? Now, training the pronators, you start in the supinated position. Stretch at the end. Palpate up here to make sure that there's turning that muscle on. When you're doing pronation, you want to palpate around the medial epicondyle to get to feel the pronator teres and palmaris longus muscles, to make sure that they're still contracting when you stretch. When you're doing supination, working the supinators, you can palpate around with your thumb around the lateral epicondyle to make sure the supinator is still contracting before you add that little extra stretch. Okay, what else?
Extension, hyperextension, and flexion of the elbow.
Okay. You're going to take a prone position. Probably not going to get too much hyperextension of the elbow, just because of the shape of the joint. Ladies will probably get some. Okay, you want to again get the humerus perpendicular to the spine, and you want him positioned enough in this direction so that the table doesn't get in the way of putting the elbow into some slight flexion prior to contraction. Okay, so here, I'm going to anchor here. He's going to push it. I'm resisting proximal to the wrist. He'll stretch here at the end. There's nothing wrong with coming over here. You know, if you're stronger with your other hand, you provide resistance like that. Okay, so that's extension. Okay, let's sit up. Let's sit up on this. I'll work your left arm. Come on, we're all going to sit right here and face that way. There you go, there you go. Okay, flexion of the elbow. Depending on which muscle you're trying to isolate. If you want to isolate the biceps brachii, then you want to get the glenohumeral joint into a little bit of hyperextension. And you want to take the radioulnar joint and get it supinated. And then resist while they flex. All the way up, come all the way up. There you go. Add a little stretch at the end. Okay, now if you want to throw out the biceps brachii and emphasize the brachialis, the best way to do that is have him in a seated position. So let's move this chair around to the back side. We'll do it right here. Okay, so we're going to lean forward like this. So if we want to throw out the biceps brachii in order to focus either on the brachioradialis or the brachialis. So if we go palm down, we're putting that biceps tendon at a disadvantageous pulling angle, and now we're isolating the brachialis. Okay, resisted proximal to the elbow. Proximal to the wrist rather. Now, if we go in the neutral position, now we're isolating the brachioradialis. Macho man here. Okay.
Retraction, elevation, depression, and protraction of the scapula.
Okay. Take a prone position, head up in this direction. We'll do retraction of the scapula, also known as adduction of the scapula. Okay, arms by the side just like he's got them. Resist out toward the end of the, out near the AC joint. And the movement is going to be from here to here. Okay. And then I add a little stretch at the end. You might want to get those fingers curled up underneath the elbow, the shoulder. Now on your back. Okay, protraction or scapular abduction is like this. And I'm going to resist around the AC joint and stretch. Okay. Next.
Depression and protraction.
Okay, depression and, okay, this would be, what we just did was protraction.
Okay.
Okay, so we'll see depression and probably
Elevation. Yes.
Okay, stand up. This could be done in a seated position. I'm tall enough to where I can usually apply enough resistance. For elevation, I'm going to resist, the movement's going to be from here to here, and I'm going to resist out near the distal end of the clavicle, right around the AC joint. Okay? I'll add a little stretch to the end. Okay, again. Okay, for depression, I like to flex the elbows. We'll start up here. Now come down. Okay. This one's a little hard to provide resistance, to add some stretch, but if you're going to add a little stretch at the end, it would be like this. Now keep it going, keep it going, keep it going. Okay. What else?
The lumbar spine flexion and hyperextension. For flexion, we have the reverse pelvic tilt and the abdominal curls.
Okay, let's do, take supine position, feet flat on the table, knees flexed. Okay. I like to cross the arms across the chest. Now this will be the abdominal curls. Some people call them stomach crunches. I'm going to go ahead and anchor here. And you want to make sure that they don't go past what I'm calling the break point. And that may be a poor label for that. But there's a point where you kind of rock over a corner, so to speak, but you're not going to go rock over it. Okay, come on up. ahead and tuck that chin before you come up. Okay, there you go. Ooh, I don't want any work going up in your neck. Okay. Now, arms by your side, reverse pelvic tilting. You're probably gonna have to get them to prove to you they know how to contract the lower half of the abdominals by putting your hand flat underneath the back. Before you do it, you tell your client, I'm gonna put my hand flat underneath your back so that they don't think you're pulling something, okay? Okay, relax. Okay, on command, mash my hand, go, and relax. Again, okay? That, and once you're confident they can do that, then you can see if they can handle a little more resistance. And you may want to put your hand under here again. Okay, mash the table with your back. Okay. Okay. He's probably close to the limit of his ability to overcome resistance. To increase the resistance, he come out here. Now go again. No, you can't handle that. So he's right in here is probably limited his ability to resist.
Hyperextension.
Okay, on your stomach. It's really a modified routine. You could slide them forward and put their waist here and let them hang all the way down. That's a real challenge. So we're just going to do the modified routine. If the extension of the back, you want it limited to the thoracic spine, then you just want to anchor here and not let them go very far up. Okay, come on up, right about there, again. Okay, now if you want to get some lumbar extension, anchor here, go up as far as you can. There you go, again. Again, of course, you can add resistance if you think you need it with this other hand here. If they have any scoliosis, you may find them going out of the sagittal plane, and you want to get them, you alert them to the fact that if they are, so, stay in the sagittal plane.
Okay.